Now let's briefly see about how we can promote children's mental well-being during this COVID-19, as it is a difficult time for all of us where our life is put into hold, and not only adults but children will be experiencing emotional trauma or stress. So let's try to listen to them. If you see any behavioral or emotional distress in the child, do not take the sign for granted. Talk to them, ask open-ended questions, give your quality time to your child or to your student. And again, constant news where you frequently discuss about this pandemic, about the rumors in front of your child, it might create tension or unnecessary stress to their child. So, in front of the child, discuss age-appropriate information about this pandemic. And again, especially during difficult times, during unprecedented times, always make time for play. Spend quality time with your children, whether it be games or his project work, or again, watching movies or playing games together. All these are important, all these recreational activities are very important for the children. And again, children need to follow these 3 R's: routine, reassurance, and regulation. During this pandemic, as there is lockdown, especially for lower classes, where there is chances where children might develop maladaptive pattern of behavior where they eat, sleep, or only watch movies. So try to include other activities in your routine: bedtime, mealtime, learning about different activities, whether working in the garden or helping in cleaning the chores. So try to make a routine for the child. And again, giving reassurance. Children also might be worried about their parents, about their grandparents. So try to reassure them that the responsible adults are taking measures as far as possible in order to overcome this pandemic. Reassure them that their parents, their near and dear ones, their grandparents are safe and following the safety protocols. And again, regulation. Try to monitor the timetable. Try to monitor the timetable, supervise the timetable, whether about sleeping, eating, hygiene, and exercises. Try to see whether the child is maintaining, so that even after this pandemic, there won't be any malpractices in the children's behavior. So these are very important for the child in order to help during these difficult times. Now coming to psychosocial management. When we talk about management, it is easy for parents and teachers to know if the child is cold or if the child is having fever. But when it comes to mental and emotional needs, it is not as obvious as physical health, because of which sometimes we missed out the warning signs. So parents and teachers, if you notice or observe any unusual behavior, always seek immediate attention, approach your pediatrician, or you can always come and approach mental health professionals. Now let's see what are the treatment modalities. When we talk about psychiatry, there are different methods of treatment such as pharmacological management, psychotherapy, and family therapy. All these are full package for the child and the family members to help them in improving the child's condition. So pharmacological management will be based on the severity of the child's symptoms. And again, psychotherapy, which is equally important as medication, where we give to the child different types of therapy such as behavioral therapy. If there is any maladaptive behavior, we try to reinforce the positive behavior and discourage the maladaptive behavior. And again, cognitive behavior, restructuring the maladaptive thinking pattern, and play therapy and art therapy. All these will be provided to the child depending on the child's need. And again, if there are any family conflicts, or if there are poor parenting skills present in the child's family, and if there is poor communication skills, we try to intervene in the family as well. So all these are treatment modalities which we provide to the patient or client as well as the family members. So when we talk about children's mental health, parents and teachers are the first ones who comes into contact with the child. So dear parents and teachers, always watch out for the warning signs. If you see or observe any unusual emotional distress or any behavioral problems, always seek for attention, always seek immediate help. Do not take all that sign for granted because earlier the diagnosis, the treatment or the prognosis becomes better. So whenever you have any unusual symptoms which is seen in the child, approach mental health professionals. And this will enable the child to lead a productive life. So let's try to create a conducive environment for the child to freely express their emotional concern and encourage the child to adopt a healthy coping strategies so that they will have a positive outlook towards life and future. So let us give importance to children's mental health because children's mental health is as important as their physical health. Thank you very much for tuning in.